This is a Hope 1032 podcast.
To She Wasn't Born Yesterday for women who are 40 plus fabulous by the Empty Nest Chicks. I'm Janet Evans, ex-M&T Saatchi advertising creative who have won numerous radio and TV awards. Not that that'll affect us because we're doing a podcast.
And I'm Dr. Amelia Haynes, who has been a medical doctor for 30 years and specialising in sexual health and mental health and relationships, and I'm generally a very useful human being.
Well, we'll find out about that, but we are here to work together.
People tell me on good authority that I am.
Really? Yes, well, they never say that to me, so I think we're the perfect hosts for She Wasn't Born Yesterday. Dr. Amelia, great to see you again.
Hello.
We're talking about fast forward to menopause today. But first of all, I have a knock-knock that I heard,
all right,
that I read
please
about.
tell me, yeah.
But you don't actually have to respond. This is how the knock-knock goes.
Okay.
Knock-knock, who's there? Mm-hmm. Menopause. Oh, no more periods. Yay! By the way, here's your beard.
Ooh.
What do you think about that?
Yeah, I know. Horrifying. Horrifying.
Now, there are lots of euphemisms for menopause. Mm-hmm. The change, the big M, the baby factory is closed. But menopause, I think, is no laughing matter because half the population of the world will go through menopause. And of us women who are 40 plus fabulous, 85% of us, I should say, will be affected by menopause symptoms and 25% get them really severely. So, on that note, shall we introduce our beautiful guest today?
Exactly. Let's talk to someone about that little conundrum.
All about that. And so we'd like to introduce Associate Professor Bronwyn Devine, beautiful name, who is an obstetrician, fertility specialist and gynaecologist. Dr. Bronwyn, welcome to She Wasn't Born Yesterday.
Thank you very much. Lovely to be here.
Dr. Bronwyn, what actually is menopause?
So menopause is when you stop having periods. Now, natural menopause normally occurs between about the ages of 45 and 55, but people can go through menopause earlier than that. They can undergo surgery, have chemotherapy or radiotherapy that induces an early menopause, and sometimes they undergo menopause earlier than 45 and indeed earlier than 40 due to other conditions or even genetics.
Gosh, wow. And so what actually happens to cause you to stop having periods?
Ovaries contain all the eggs they're ever going to have when you are a fetus inside your mum. And you have the maximum number of eggs when you're about 20 weeks gestation. And throughout your life, you lose your eggs. You don't just lose them after puberty. You don't just lose them once you start getting your periods. You lose them all through your life until you get to menopause. And when you get to menopause, you've got about 1,000 eggs left in your ovaries. But those eggs are pretty much done and dusted. They're not going to give you any more bubs. They're not going to give you any more cycles. So basically, it means you've got to the very end of your reproductive life and you will not be able to reproduce after that time. We define menopause as the time when we get to 12 months of no periods. And there are 3 stages. We talk about perimenopause, menopause and post-menopause. And menopause in and of itself really just means the time when you get to 12 months after having no periods. But perimenopause is that really tricky time leading up to that. And for some people that can last a number of years. For some people it can be quite a short time. And certainly if you have an operation and lose your ovaries and go straight into menopause at that time, then your perimenopause may be very brief indeed. But those perimenopausal years are often the years where people really suffer a lot of their what we call menopause symptoms.
Yeah.
Oh, okay. So
as everything's fading away.
Everything's fading away.
But you're likely to suffer it worse in perimenopause than actual menopause?
Sometimes, and, if you think about menopause is really just the time that you hit 12 months of no periods. In the post-menopausal years, we're getting older and we age. There's lots of things that are associated with aging. In the perimenopausal years, and certainly people often say, when you hit menopause, that's it, you can't have any more children. But often for even 10 years leading up to menopause, people find that their fertility is really at such a low level that they won't be able to conceive a pregnancy. So there's a lot of people in their 40s who are trying for a pregnancy and they're really struggling. And using their own eggs. And one of the reasons for that is that our egg quality really does deteriorate in the 10 years leading up to the end of our reproductive.
Yeah, right. And so what would be like an example of like mild symptoms compared to these very severe symptoms that some women have?
Sure. And look, it's a very, very much an individual experience. Some people really have quite a cruise through their menopausal or their perimenopausal years, and some people really, really suffer, and there are all sorts of variations in between. But the sort of symptoms that people classically get, certainly one of the ones everybody sort of talks about is hot flushes, or what they call in America hot flashes. And that's associated with declining estrogen levels, but it's not just specifically due to declining estrogen levels, because there are other times in people's cycles when they have declining estrogen levels and they don't experience hot flushes. The hot flushes are a really quite unpleasant experience where you can really feel like your whole body's on fire, or you can have this sensation where some people feel it almost like when they were in school and standing up and having to recite some poetry or something, and they had that real sense of
that they didn't know. Yeah.
And you sort of feel like cheeks are burning and you're blushing all over. That hot flushes can feel like that.
And you're sweating. You're sweating, right?
Some people, have sweat pouring down their back and they're dripping sweat. Some people just feel a general sense of overall heat, but it can be quite unpleasant. It can last some minutes, or it can be really quite fleeting. So it's different for everybody. Some people have hot flushes for a short time. Some people have hot flushes for a couple of years. And then even into post-menopause, they'll occasionally get a hot flush. A lot of women will report feeling a hot flush that can be triggered by anxiety. So they might be in an anxious situation, then all of a sudden that triggers a hot flush. Okay. For some people, they get them for many, and they may find that the frequency of them declines as the years go on, but there are some women well into their 60s who are still experiencing occasional hot flushes. And then some people have them for a brief period of time, maybe only have them for a few months and then they never have them again. So it really is an individual thing. The other sort of classic symptom people experience in menopause is dryness of the vagina. So dryness and discomfort of the vagina. They may find, the medical term for that is urogenital atrophy. So associated with that, they may find they get some an increase in there. Nasty. They might find that when they run or cough or sneeze, they get more bladder leakage, that sort of thing. And then intercourse can become painful because the vagina is drier, and that's associated with declining levels of estrogen. Typical symptoms that people can experience at this time is brain fog. So one of the things people say is that I just can't seem to get my thoughts together. I feel like I'm not thinking clearly. I'm forgetful. I'm really worried I might be getting dementia, but I just have this sort of constant brain fog and fatigue and just feeling really sort of in a blur and a daze a lot of the time. And that's a really debilitating symptom for a lot of people. As well as that, their libido can diminish. So they're finding that they may be in a very stable and happy relationship and they really love the person that they're with, but they really cannot be bothered having sex. And they just don't feel any drive at all. And a lot of women will come to me and say, look, I really was quite sexually, I used to really enjoy it. And now I really could not be bothered. So that's a sort of quite a common symptom as well.
This just isn't fair, Bronwyn.
Oh, it's really unfair. It's rotten tight. But yeah, people are, a lot of people in their 40s and 50s are dealing with their kids in high school and the traumas that adolescent kids go through. So they're dealing with that. They might be, working in a fairly senior role at work and they've got a team working under them and there's a lot of issues associated with that. They may have elderly parents that have health challenges, and they may have a partner who is also going through similar symptoms or health issues of their own. So it's a tricky time.
The need to own a red sports car. I think.
Yeah.
Yeah.
Yes, yes.
Or a toy boy to go in it. And so it's interesting because Kathy Lett talks about menopause as an interval in women's lives. And she says, I think for women, life is in 2 acts. The trick is surviving the interval. The menopause is the interval. The menopause is awful, but once you get through that, it's the best time of a woman's life. No one talks about this. So what do you think about her take on menopause, Bronwyn?
I think that is, for some women, that can be, a very true experience. For others, it can, a lot of people find they struggle through their older years. They lose their sense of self. They may be out of work. They may be divorced and separated and homeless and all that sort of thing. So for a number of women, the late can be very, very challenging. But if we think about someone who's reasonably well settled and, has a paying job and children who may have moved out of the home, that can be a time of, certainly when you get through that period of time where you're having those ridiculous symptoms and settle down a little bit. If you're partnered and contraception has been a concern for you in that relationship, you no longer have to worry about that. So you can have a fair bit of laissez-faire in terms of your sexual practice. Doesn't mean you shouldn't be careful about other things like STIs, but certainly in terms of contraception, if that's an issue in that relationship, or it has been, it is no longer an issue in the postmenopausal years. And people may find they're looking forward to retirement. They've still active and in reasonably good health. They can travel. Their children have grown up. So certainly what I think Kathy Lett's referring to is a lovely time of being settled and at peace with yourself. And I think if you get to that stage, that's wonderful. For a lot of people, there are still a number of ongoing health challenges and life challenges.
Kathy Lett might have been talking about Kathy Lett
Yes,
a little bit.
she was.
A little bit.
She talked about being able to carpe the hell out of diem.
Yeah.
Basically, which I think is a fantastic slogan.
If you can carpe the hell out of diem, then good on you.
Go for it.
Yeah.
Bronwyn, do women see you potentially through all of their lives from childbirth through to menopause? Do you have patients like that?
Certainly, yes. When you've been practicing for a few years, I mean, I'm not yet quite at that level where people that were born with me as the obstetrician are coming to me in the menopausal years, but
Yeah.
certainly I have cared for people who, through their reproductive life, who have children, finish their childbearing years and then need sort of advice and support through their menopausal years. And that's one of the lovely things about medical practice and one of the lovely things about working in the area in which I work. It's a real sort of cycle of life type of profession and incredibly enjoyable and rewarding.
Yeah.
My vacuous question for Bronwyn is, when you're through menopause, what do you think, with actual medical knowledge, not through just wishful thinking, what sort of things can help you stave off the kind of looking very kind of worn? What sort of things can a woman do to look less worn out?
I have no expertise in cosmetic surgery and enhancements in that area.
No.
Although that's a whole podcast and
that's a whole
different,
other thing. Yeah.
I think, maintaining a healthy lifestyle, eating well, staying hydrated, getting some regular exercise, getting lots of sleep, which is a real issue for me in my work, but getting lots of sleep and, sort of getting on top of mental health challenges and things like that. I think all those things are really important. There is always, and certainly in my premenopausal years, there was a lot of focus on the benefits of hormone replacement therapy to keep you young and beautiful. And in the 90s, when I was a registrar in obstetrics and gynaecology, our teaching was pretty much along the lines, as soon as women hit menopause, their menopausal years, they need to be on hormone replacement therapy, because hormone replacement therapy keeps you young, protects your bones, looks after your skin, reduces your risk of Alzheimer's disease, reduces your risk of cardiovascular disease. And it's just, what's not to like. And there is certainly a number of of people who still follow that philosophy, and there is without a doubt a number of health benefits from taking hormone replacement therapy. But when I'm talking to women about whether or not they want to use hormone replacement therapy, it needs to be a collaborative discussion, and it needs to be an individualised approach. Hormone replacement therapy is definitely the right thing for some people, and it's not the right thing for other people. It's very much, instead of this one-size-fits-all approach we had in the 90s, prior to the Million Women study and the studies that came out at the end of the 90s that made us stop using HRT overnight, the pendulum has swung right back. There's a lot of people who get a huge amount of benefit in multitudes of ways, get a huge amount of benefit from hormone replacement therapy. And there are other people who don't like the side effects, who are concerned about some of the risks, who shouldn't use it because of the risks. But if your sort of question, Amelia, was around what can you do to stay young and vibrant?
Staying young and kind of plump. Staying plump for as long as possible.
Young and hot, but not sweaty.
Yes, hot but not sweaty, that's right. And that word plump is as in, if you think about plumping up the elasticity of your skin and the collagen, all those things, which estrogen...
Staying plush for as long as possible. Yeah.
Yes, which estrogen is really fabulous at doing.
What if you just rub estrogen cream all over yourself? Does that help?
That's probably excessive.
Yes, well, estrogen, and yes, there's plenty of hormone replacement therapy modalities now that you apply transdermally. So patches and gels and creams and topical creams.
Oh, okay.
And they, in fact, the recommendation is that if you can take estrogen that way rather than swallowing it, it is better for you from reducing your risk of stroke and reducing your risk of venous thromboembolic disease, so clots and things like that. So taking estrogen topically through the skin is a really good way to do it, and can reduce a lot of the so-called risks that we have concerns about with hormone replacement therapy. So yes, and rather than sort of smother yourself with it, you can rub a small amount into your tummy or rub a small amount into your forearm once a day. And for some people, vaginal dryness and that urogenital atrophy is the real issue of menopause, and they find that inserting some creams and things transvaginally is all they really need. So there's lots of approaches. And again, individualised therapy. So.
But estrogen is in your body naturally before menopause, or a certain amount. So why would replacing it cause these sort of unpleasant and risky side effects?
Estrogen is what we call a thrombogenic hormone. It does increase the risk of clotting. And we know, for example, pregnant women have an increased risk of getting clots in the leg when they fly in planes, when they have prolonged periods of immobilisation. People who take the combined oral contraceptive pill have the same risk. So estrogen increases your risk of clots in the leg and pulmonary embolus and strokes and things like that. So estrogen's got that sort of risk associated with it. Even though it's fabulous and wonderful, it also causes enlargement of breast tissue. So a lot of people find when they recommence or commence hormone replacement therapy with estrogen in it that they go up a bra size, which may or may not be something that they enjoy.
Yeah. I was going to say, it could be a good thing. But so what are some of the alternative treatments and do you recommend those?
Yes, there's a number of things that have been tried over the years. There is a new sort of class of agents that has been approved for use in May this year in the United States, a new agent known as a neurokinin 3 receptor antagonist.
Wow.
And that's something that has been used to treat hot flushes, or what, as I say, hot flashes in the United States. That's not available here in Australia at the moment. So there are some alternatives, and in the past a medication called clonidine was used in a similar way, so a non-hormonal approach to treating hot flushes. And then there are certainly, rather than the standard estrogen alone or estrogen and progesterone hormone replacement therapy, some people find that an addition of testosterone cream can really help with their sex drive. There is a condition that has been known in the past as female androgen deficiency syndrome, androgen being classically the hormones that are traditionally produced by the testis, but also are produced by the ovary in premenopause. Those hormones, including testosterone, are what generally gives us our libido. And in premenopausal women, testosterone levels peak at the time of ovulation. So isn't nature wonderful to make everybody feel like they want to have sex at the time that they're ovulating?
You can have a baby.
Very good.
But post-menopause, the ovaries do diminish their testosterone production. And testosterone is not only a hormone that increases libido, but it also gives you a bit of sense of well-being and a bit of, sort of swagger. And I reckon I've got this. I've got a bit of confidence.
Aren't men lucky?
Just I feel good.
Aren't men
and in fact, a
lucky?
lot of trans men who start taking testosterone feel really affirmed and fantastic when they've got some testosterone, because it really is a good hormone for feeling really on top of your game.
It really is the swagger hormone.
It really is, yes, it really is.
Swagger hormone, I like that.
And so some people who have gone through menopause and are really noticing a diminution in their sex drive find that replacing testosterone can bring that back to life. So certainly that's another alternative to the estrogen, progesterone, traditional HRT that can be used. There are also some sort of non-regulated products that you can buy, for example, troches in compounding pharmacies that people use, and, they don't necessarily have regulated doses in them, so it's hard to know what particular doses people are on when they take those things, but some people have found benefit from them. And there are other things such as the isoflavones, some of the soy-based products, which have gone a little out of favour now, and black cohosh and some of those more herbal approaches, remifemin and things like that, that some people find really help with their sleep or their hot flushes at night.
And so do you think that before you go through menopause, in perimenopause, you should go to your doctor and sort of figure out what might be best for you, or do you only really discover it as you're going through it?
Yeah, look, I think it's worthwhile. I think a lot of people, and probably is more, I haven't answered your question yet, but there probably is more of a focus on menopausal and perimenopausal symptoms now. And there's, if you think about in the 50s, people in their late 40s and 50s were possibly, in grandparents' age and maybe thinking about retirement, moving to a retirement village, and sort of, let's put those people on the back burner, they're not contributing to society anymore other than just being in the retirement village. And I don't mean that in any denigrating way, but now there's a huge number of people who still parents of fairly young kids in their early 50s and are still, anticipating being in the workforce for a number of years. And so being on top of menopausal symptoms and being a vibrant, working, active, healthy contributor to your own life and to society is now very much part of your menopausal years. So I think that there is a bit more of an understanding. I for example, can be working in birthing unit, and a midwife in her early 40s can come to me and say, could I be in perimenopause? I'm just feeling exhausted and weighed down, and I'm not sleeping well, and I kick off the blankets at night, and, I'm a bit over it, and I'm stressed, and I'm worried about my mood and things like that. So this is typical perimenopausal symptoms. So I think it is really worthwhile if you're noticing, that there's just something's not quite right. Yes, my sleep's deteriorating. Yes, I'm starting to feel hot and bothered. Yes, my mood's going up and down in a crazy way. I think that's a time to sort of say to your doctor, could this be something I need to think about? And if you go to your doctor and they say, I don't know much about that, or, tap, tap, tap on the hand, you'll be right, go to another doctor. Ask to see someone. There is plenty of support out there.
Is part of your role ever to visit or inform corporate, companies about what they can do for women employees who are in the workforce longer and are going to go through menopause?
So I've not specifically gone into the workplace and advised, but I do know that the Menopause Society and a number of other organisations are really championing this idea of getting organisations to improve menopause awareness. And I think, as I mentioned, people in their early 50s are no longer thinking about buying a place in a retirement village. They're thinking, I'm at least going to be working till I'm 65 and I could still be paying off my mortgage and
More like 95.
Yeah, exactly. I will be.
But we're all living longer. It's not the end of the world, is it, to work until
Not
you're
at all.
75?
And so I think that, improving the understanding of menopause and just sort of there's a real focus now. And I think COVID has contributed to this as well, to sort of improving conditions for employees and making it easier for people to work from home and not be discriminated against or stigmatised against because they may have some health challenges. I think improving understanding amongst your peers at work and your supervisors at work and making sure that, there is a real focus on health and well-being in the workplace and sort of looking at ways that we can be flexible so that if people are having a particularly rough time, that they can maybe look at reducing their hours for a period of time or working from home for some days a week if that works and things like that. So I think even since COVID, there's been a lot of workplace changes for the better. And I think that now that menopause is no longer, just the province of dotty old ladies who can just put up and shut up and just, sort of take a Bex and have a good lie down. I think now, there really is, there are a lot of women in their menopausal years or postmenopausal years who are still very positive, active contributors in a workplace and that we need to make these adjustments.
I wonder if men went through menopause that it would be part of corporate policy much earlier.
This is the thing. And for cis men, there is a condition that's recognised now known as andropause. It tends to affect men in their 40s and 50s, associated with declining levels of testosterone. And it's associated with sometimes a diminished sex drive, so a decreased libido, but also erectile dysfunction. They develop a different fat distribution, so they tend to notice they get more fat around their abdomen and they may develop some what we call gynaecomastia or in common parlance man boobs.
Oh, man boobs.
And they become irritable and bloody awful to be around, really. But they become irritable and grumpy old men. And so, that's definitely recognised. For gender diverse people as well, there's lots, again, it's very much an individualised approach because, say, for example, a young trans man may elect to have a total hysterectomy and ovaries removed at the age of 27 and therefore will, even though he may be taking testosterone and getting all the lovely swagger, effects of that, he may also feel really quite compromised by hot flushes and things like that at that time. And then, going into those menopausal years as well, certainly for trans women, trans women don't have ovaries and won't have changes in bleeding pattern, but they certainly can go through some hormone fluctuations if they're changing their dose or associated with ageing and things like that. So very much an individualised approach, for all the patients that we see.
Yeah, fascinating.
Yeah, well,
Dr. Bronwyn,
fantastic. Bronwyn's been marvellous.
Amazing. And we've really fast-forwarded through menopause.
We have. You've been
the whole
topic. So very full in what you've
covered a lot of ground. Yeah. That word atrophy just sticks with me. I just think,
urogenital atrophy.
Just horrible.
It's like,
get amongst it.
Is it like a dead vagina? Is that what it translates to?
It means the skin gets thinner, thinner, drier.
Just,
shrunken.
Very.
Can you get a vagina replacement?
Well, there are some places out there. I don't do it, but there are some people who do rejuvenating things and, sort of inject various things and fillers, as it were, vagina fillers and, sort of do some rejuvenating type procedures.
I'm just going to pop in for a vaginal rejuvenation.
A bit of a flush up.
A lush and plush. Lush and plush, as we said before. So.
Gorgi, we hope you enjoyed this episode, but we'd love to get to know you better and share more about our lives, what we get up to, what you get up to, and some insider goss and cheeky sneak peeks.
So why not join our Facebook group? It's called She Wasn't Born Yesterday, for lots of little extras. Your chance to comment, make suggestions, tell us if there's a topic you'd like us to talk about.
Or just to say g'day. Either way, join us next week on She Wasn't Born Yesterday. We look forward to your company.
Hope 1032. Thanks for listening.